5, the son of the man who created the vaccine to prevent polio is offering a warning and a plea. As the nation fights its worst measles outbreak in a quarter century, Dr. Peter Salk says the country has let its guard down. He spoke with senior health correspondent Monica Robbins and shares a message for today's parents.
For decades, vaccines pushed the diseases of childhood into the background. Measles, whooping cough, polio, so far out of sight that many parents today have never seen what they can do.
Since parents are frightened of these things now because they are brought under control by vaccines, this is not on the top of people's minds. And the danger of that is that people will begin to pull back and think, oh, well, you know, we don't want to immunize our children.
Dr. Peter Salk watched his father develop the first polio vaccine. He was one of the first to get it in his home kitchen. Now he watches vaccination rates slip and eradicated diseases return. His message: science is not the enemy.
It's sending the message that one needs to respect science. Science is not a bad word. It can be misused, of course it can. But it has such value in being able to evaluate what are the pros, what are the cons, how do we weigh things against each other.
He says the country needs an open conversation, not a shouting match. And the people to start it are the ones who remember life before the shots. That's the idea behind a movement born in Cleveland. Grandparents for Vaccines now reaches 32 states and more than 75 media markets.
Grandparents also bring the message of what the world was like before there were vaccines. So at a time when a lot of people are saying, do we really need the vaccines? The grandparents are saying, okay, that's fine, we can talk about that. But before we make that decision, we want you to know what that world looks like.
The group isn't focused on Washington, it's focused on trust, and the two people a young parent is most likely to believe.
One thing people still trust is that grandfathers and grandmothers, like myself, dearly love their grandchildren. And if they care about their grandchildren, that's something that people believe in.
Both doctors say the answer isn't fear. It's an honest talk with someone you trust.
If you're fortunate enough to have a good relationship with a family physician or whatever doctor or nurse or healthcare professional is helping to take care of your health, have a conversation about vaccinations with someone who knows this area and is keeping educated about it.
Take a look at this. This is a map of measles cases from the Centers for Disease Control and Prevention. Look at Tennessee right now. There are no confirmed cases. South Carolina, though, has recorded well over 600 cases. Utah is behind that at 490. Tennessee just one of 12 states reporting no cases.